Good morning, good afternoon, good evening for those who are watching us from different parts of the world. I'm very happy and honored to be here at this fifth summit to discuss several topics related to sustainability. As we are crossing the first year of a new decade, when we have the chance to accelerate our efforts towards a better world. From the first phase of the pandemic in early 2020, so something 18 months ago, at ISWA we started to collect information and discuss about the impacts of COVID-19 on the waste industry. Since then, based on the knowledge and experiences acquired within ISWA, we reached three main conclusions to which we dedicated the most of our attention and efforts. First, waste management services are essential in nature, and this was highlighted with emphasis throughout this period. Second, waste workers are part of the most important sanitation barrier, deserving total assistance and protection. And third, waste is not a direct vehicle for the transmission of the new coronavirus, since it's a community disease mostly transmitted by air and close contact between people. Due to new behaviors, new patterns, lockdowns, and social distancing measures adopted in different parts of the world, new types of waste have been registered and an increased amounts of waste were generated. A specific point of great attention during this period was related to the medical waste, considering the trend of an accelerated growth in its generation as a direct result of the COVID-19 and because of its characteristics of hazardousness with added risks. A side effect and emerging concern is that not only the treatment and health assistance to patients with COVID-19 poses new pressures on the existing waste management systems. Vaccination procedures, the greatest achievement against the pandemic, generate huge amounts of materials that needed to be collected, transported, treated, and disposed of adequately all over the world in order to avoid it ends up in the wrong places, carrying a major risk to the environment, to workers, including the informal sector in many parts of the world, and to public health, as those are infectious materials that can be contaminated by several different viruses and other pathogens. Another problem is the added value that needles and syringes get in the black market, attracting criminals to recover discharged items in open dumps and other inadequate sites, to reintroduce them in the market by selling or reselling to healthcare facilities. The situation shows that the problem is not only related to the product or material, but it's related to the adequate infrastructure to handle all types and quantities of waste, and most important, about how to properly dispose of our waste and ensure that we have adequate systems available for correct management. This is also something much related to the concepts of the circular economy that proposes a change in the current linear model, starting with the design of the products and materials chosen for the manufacturing processes. And now, the whole world is talking about the post-COVID period, announcing the green economy as a pillar for growth. And all those themes are directly linked to ISWA's mission. The lack of a sound waste management system bears a direct threat to the public health, including human and environmental health, resulting in enormous or even permanent impacts at high costs to the society. On that sense, stronger international collaboration and more action is still needed to empower a comprehensive response and to include waste management as a higher priority, receiving the right attention and enough funds towards a cleaner and healthier future. So thank you very much for this opportunity. I hope we can discuss a little bit more about this very important topic, and congratulations for the event. Thank you very much.